Okay, so you've all heard of good cholesterol and bad cholesterol, right? Heard of that? How many know what the good cholesterol is? Which one is that? The HDL. Okay, so it's easy to remember HDL, healthy HDL, H for healthy, okay? Now, if you have, I think of HDL as being like the scrubber. It goes through the body, and when it sees these bad particles, it basically gets rid of them. So one of the worst case scenarios is actually not having enough HDL. Frequently, I'll see people who have normal-looking lipid panels. Their LDL cholesterol's fine, their total cholesterol's fine. They don't have enough of the good cholesterol, and nothing's really done about it. Their doctor will say, why don't you exercise a little bit? That is almost the highest risk patient is the young woman with a low HDL. When I see that, I panic. And I get aggressive with her because it's a very, very high-risk scenario. So you need to know what your number is. And if you're a woman that's less than 50, I don't care if it's 48, that is of concern. If you're a man, anything under 40 would be of concern as well. And we're going to talk about HDL because HDL has a lot to do with when we start thinking about this metabolic syndrome. Low HDL goes along with that, okay? Now, having said that, this is one thing that's going to probably shock all of you. High HDL, okay, having a lot of the good cholesterol, is no guarantee for cardiovascular protection. So if you're walking around with a high cholesterol and your HDL is 80, and your doctor or your nurse practitioner or healthcare provider tells you, you know what, it's okay, you don't need to worry about the fact your total cholesterol is high because it's all the good stuff. Unfortunately, HDL, if it's working, provides protection. But sometimes it starts to not work. It actually becomes pro-inflammatory, it increases inflammation, and actually starts to cause disease at very high levels. So you absolutely should not be falsely reassured that just because you have a high HDL that you're not going to have a heart attack. If you have a family history of heart disease, if you have a high total cholesterol, if you have other risk factors, that HDL is no guarantee at all. 20% of women who have a high HDL in this big Framingham population had heart attacks. So part of what we do with our advanced testing is we can identify some of that risk that's present even in the setting of high HDL so that we can better advise patients with that scenario. So it is considered the healthy cholesterol as long as it's working. The time most often that HDL is going to start to go bad on you is if you have diabetes or you have metabolic syndrome. So we're all going to try to figure out whether we have that by the end of today.